Hello, everyone, and welcome back to The Explainer. Today, we're setting off on a truly fascinating nutritional investigation. We're going to be looking at some recent medical studies and data that reveal how tiny, literally microscopic nutrients play an absolutely massive role in our everyday vitality. It's like a giant puzzle, and we're putting the pieces together. So, have you, or maybe your friends or family, been feeling this lingering, totally unexplained fatigue lately? Maybe some hair loss that just won't quit? Or that low energy funk that sleeping for 10 hours just can't seem to fix? We usually just brush this off, right? We blame stress or our crazy modern routines. But the data, well, the data suggests your body might actually be quietly whispering that it's running critically low on absolute essentials. Okay, let's dive right into this with a really compelling medical mystery documented in the European Medical Journal. It involves a 65-year-old woman who arrived at the ER facing a sudden and terrifying decline in her health. And what's crazy is she was completely independent and autonomous in her everyday life just a few weeks prior. The clinical details were, quite frankly, severe. Over just 10 days, she developed profound weakness in both of her legs. She was suffering from urinary retention, fecal incontinence, and marked gait instability. Basically, she just couldn't walk properly or balance at all. Now, you might be thinking stroke, right? Or maybe an irreversible spinal lesion, but no way. Neuroimaging showed zero structural causes. The real culprit? A staggering drop in her blood levels. Her vitamin B12 level was less than 100 picograms per milliliter. That is a severe deficiency. So, this severe B12 drop actually triggered a condition called subacute combined degeneration. Essentially, your body absolutely needs B12 to maintain myelin sheaths. Think of them as the protective insulation around your nerves. Without it, progressive demyelination happens in the spinal cord. But here is the good news. Because her doctors had early clinical suspicion, they treated her immediately with cyanocobalamin, that's vitamin B12, injections. And her symptoms? Completely reversed. 6 months later, she walked in completely asymptomatic with zero neurological deficits. It just goes to show you exactly how powerful giving the body what it needs can be. The triple malnutrition burden, scaling out to the population. Now, while that was a pretty extreme clinical case, it brilliantly illustrates a much wider, quieter crisis. You see, our modern indoor lifestyles and our heavy reliance on processed foods, they're silently draining our essential nutrients. Just look at this study published in the Indian Journal of Community Medicine. They looked at young, non-pregnant women aged 15 to 24 in a rural area of Haryana, and they discovered a simultaneous triple burden of malnutrition. The numbers here tell a really surprising story. 35.1% of these young women were underweight, while 18% were overweight. But the most striking figure by far, 60.7% were anemic. The researchers noted that a staggering 98.2% of these women did not have adequate dietary diversity. So what does this all mean? It proves that malnutrition isn't just about weight. It is entirely possible to be overweight while simultaneously starving for critical micronutrients like iron and vitamins. And speaking of iron, wow, this brings us to a massive nationwide statistic. To put this into perspective, according to National Family Health Survey data, an astonishing 57% of all Indian women between the ages of 15 and 49 suffer from anemia. Let that sink in. More than half. And what's even more concerning is that this number hasn't gone down. Actually, scratch that. It went up from 53% in the previous survey window. That is a staggering number of people just walking around every day with reduced oxygen carrying capacity in their blood. Iron and your heart. The cardiac connection. Let's shift our focus to how a lack of simple minerals directly affects the body's hardest working organ, your heart. These open-access medical journals highlight a vital yet frequently overlooked link between iron depletion and cardiovascular illnesses. We almost always think of iron solely in terms of, feeling a bit tired, but it is fundamentally required for mitochondrial activity, the metabolism of cardiac muscle, and managing your inflammatory response. In fact, about 30% of heart failure patients have an iron deficiency. When iron is missing, oxygen transport drops drastically, which significantly reduces a patient's exercise capacity and actually worsens the progression of organ failure. Now, interestingly, studies have shown that for heart failure patients, your standard oral iron pills often aren't recommended because of poor GI absorption and side effects. Instead, intravenous iron delivery can significantly and effectively alleviate their symptoms. It literally breathes life and energy back into them. Building better bones, the calcium crisis. moving from the heart to our structural foundation, we arrive at the next silent crisis. Experts estimate that globally, low bone mineral density is expected to spike by a massive 40% by the year 2050, which obviously greatly increases the burden of osteoporosis. But we have data on how to fight back. Now, what's really interesting about this slide is a really cool study in South India that took women aged 30 to 50. Before the intervention, 100% of the experimental group had mildly reduced bone mineral density. They were given a specific dietary supplement every morning, and after just 16 weeks, boom, 80% of these women beautifully transformed and returned to completely normal bone mineral density. So, you're probably wondering, what was this magical, effective intervention? Well, it wasn't some expensive pharmaceutical, I can tell you that. It was a highly effective calcium-rich mix made of everyday, accessible ingredients: ragi flour, wheat flour, sesame seeds, and milk powder. Consuming just 100 grams of this mix yielded 735 milligrams of calcium. Sesame seeds, for instance, are a fantastic alkaline food that promotes bone health with organic minerals. It's the whole shebang. It beautifully goes to show how everyday foods can powerfully prevent conditions like osteoporosis.
Modern lifestyles missing nutrients. Simple fixes for a healthier you.
Okay, so our modern lifestyles may be missing key nutrients, but as you'll see from these studies, the fixes are highly actionable, incredibly simple, and wonderfully effective. Let's walk through this nutrient roadmap to see how we can reclaim our health and energy. For vitamin B12, the modern issue that vegetarian diets often naturally lack it, right? So the daily fix is ensuring you add fortified foods, dairy, or a targeted supplement. For vitamin D, our indoor screen-heavy lives completely block natural synthesis. The fix? Simple. Step outside and get 15 to 20 minutes of daily sunlight. And for iron, the issue is often poor absorption. So just pair your iron-rich meals with vitamin C, like a quick squeeze of lemon, to help your body absorb it.
So let's lock in these actionable daily habits. 1. Eat consistent meals and try to include a protein source. 2. Get that 15 to 20 minutes of sunlight. 3. Pair iron with vitamin C. But step 4 is absolutely crucial. So the crucial point is, always get a blood test before taking new heavy supplements. Seriously, don't just guess. Taking too much iron or vitamin D without knowing your baseline levels can actually cause toxicity. A simple blood test, guided by your doctor, is by far the safest and smartest starting point.
Remember, guys, these deficiencies rarely happen overnight. They build up quietly over months, sometimes even years. Your body keeps adjusting and adjusting until it simply cannot anymore. That is exactly why early detection and simple, consistent daily habits are the ultimate keys to your long-term vitality. Prevention is just so much simpler than cure.
And that brings us to the core focus of our explainer today. We are happy if we are healthy and the people around us are healthy. It's all connected, right? If you found this investigation helpful, please share and subscribe if you like, for healthier friends and a healthier society. But before you go, I want you to ask yourself, what is your body quietly whispering to you right now?